one thing can change your entire birth experience for the better. The way you move and position your body during pregnancy can make all the difference in your birthing experience. This is because the positioning of your baby really determines how quickly your labor is able to progress and how easily they are able to navigate the pelvis. We don't want to be doing a lot of slouching and lounging reclines or a lot of crossing your legs. This can encourage baby to turn into what is called an occiput posterior position or an OP position. This is when baby's back is facing your back. They are sunny side up or looking towards the ceiling. This makes it a lot harder for them to navigate the pelvis and actually makes the diameter of their head bigger. It can make the pushing phase of labor much longer. Sometimes people push for hours and still end up needing a C-section because baby is not able to tuck their head, which is an important part of the cardinal movements, which is how they navigate the pelvis to be born. We want baby to be in the occiput anterior or OA position. This is when they are looking towards the floor, which allows them to flex their head and move through the pelvis much easier. So easy ways to ensure baby has the best chance of getting into a good position for labor. The birth ball is a great tool for you, not only in labor, but also for pregnancy. You can actually ditch your chair completely. If you worked in an office, replace your chair with a peanut ball. If you're watching TV at home, sit on a peanut ball. You want your knees to be lower than your hips. There are different sizes available, and you want to check to make sure that it is the right size for you. So when you are sitting on it, you do want your knees to be lower than your hips, or at least lined up. You do not want your hips to be lower than your knees. That is not the position we are going for. You can do circles on the peanut ball. You can do side to side. You can do figure eights. You can do some gentle bouncing. Bouncing isn't actually going to help labor begin. Just the different movements to open your pelvis are what are going to be more helpful than just the bouncing up and down. We want to be making more space for baby, so doing these like big exaggerated movements, circles. Another easy way to get baby in a good position is doing hip openers. So hip openers are going to be things like squats, butterfly position, lunges, asymmetrical movements. So you can have one leg up on a better couch and one leg down on the floor and do kind of like a lunge or back and forth rocking motion like that. Anything that's going to open the hips and allow baby to engage is going to help baby get in a better position. Doing those asymmetrical movements is really helpful for helping baby to navigate the pelvis. You can never go wrong with walking and staying active in that way. If you have determined that baby is not in an optimal position for labor, maybe at your ultrasound appointment, it was found that baby is breech, which is normal up until about 32 weeks. Baby is usually in the head down position. It can happen later than that, but the bigger baby gets, the more challenging it is for them to flip head down if they still are breech or transverse. So we really want to be doing what we can to encourage them to flip head down before they are big and it is harder for them to do so. If you have determined that baby is not in an optimal position, you can check out Spinning Babies. They have a website. You can also work with someone who is a Spinning Babies instructor. A lot of doulas know Spinning Babies techniques, so you can check those out to help get baby in a good position. So the next time you are lounging, getting some rest while bonding with your sweet baby, make sure that you are being mindful of your positioning. It's just small little tweaks that make the biggest difference when you are pregnant and preparing for birth. So instead of laying back on the couch, just try to sit forward. Put some pillows behind your back to keep you upright. It is better to lean forward than it is to lean back. You want to forget about being ladylike in pregnancy. So you want your legs to be nice and open. You want to be giving baby that space to move, to engage, to get into a good position. You don't want to be closed up. You don't want to be crossed. All of that is going to prohibit baby from moving and getting in a good position for labor and birth. Drop the concept of being ladylike. Open those hips. Lots of hip openers, lots of movement, lots of sitting on the birth ball, not a lot of slouching, not a lot of couch potatoing. We want you to be up and active. Pregnancy is a time that you want to be getting that rest in, getting plenty of sleep, being comfortable, but also being mindful of ways that you can help your body and your baby prepare for the labor process. We want to make things as smooth and easy as possible for you both so that you have the best experience possible. Thank you for joining us today. Please make sure to subscribe so you don't miss out on the rest of the 30 Days to a Better Birth series.